Are you trying to improve or create awareness among your colleagues and healthcare decision-makers about the burden of stroke in your country? Are you determined to contribute to boost your journey of developing stroke care? Let's see how a partnership with Medtronic can help you. The number of strokes in your country is high and is expected to grow, and most of them are not being treated. You have been part of the efforts made to improve care provision in some areas, but you know it is not enough. It has been a challenge to get the attention of decision-makers towards stroke, despite the devastating consequences for patients and society. However, you know for sure that today, patients can benefit from effective treatments and from an improved organization of care. And to move towards that, greater focus and incentives for stroke care development in the country are needed. Through partnerships, Medtronic can support you to develop the economic case to create awareness among key stakeholders and ultimately to facilitate the budget and resource allocation for stroke. We will use the Stroke Care Economix tool, which provides a framework in which you will be able to assess the impact of stroke on patients and on your national economy. So, where to begin? Developing stroke care in a system is a complex task that requires alignment between multiple stakeholders, intensive planning, and effective implementations. So, let's say that based on your country's situation and needs, you identify that the first steps to start with the development of stroke care could be to develop official clinical guidelines and standards for stroke treatment, establish reimbursement codes and tariffs for stroke care treatments, or optimize resources allocation to create dedicated stroke units and facilitate treatment access. Now, how can we use the Stroke Care Economix tool to support you and meet your objectives? Through a collaborative process of data collection and validation, we will estimate the current burden of stroke for the patients, the economy, and the society in the short, mid, and long term. First, you will be able to create awareness of the current burden of stroke in your country. Second, and more importantly, you will be able to model eventual changes to the stroke care provision, thanks to the instruction of new standards of care and treatment reimbursement. Such changes can include the introduction of stroke units and increase the uptake of reperfusion treatments. Using this model, you will be able to estimate, for example, the impact of development changes on the number of patients treated in stroke units, the potential number of patients treated with thrombolysis and mechanical thrombectomy, the proportion of patients achieving functional independency, and finally, the economy of the healthcare system and society in the short, mid, and long term. Through results of our collaborative work and analysis of several scenarios, you will have the tools to communicate with impact the burden of stroke to healthcare decision-makers, and to show how the implementation of new policies and standards could benefit both patients and the healthcare system. Ideally, this will open doors for discussions towards the stroke care development. This would be one small step for the stroke care development, one giant leap for stroke patients. Let's partner together to inform healthcare decision-makers about the value of optimizing stroke care and the meaningful benefits that can bring to your patients. Let's partner together to communicate with impact. Medtronic is your stroke care partner.